The name of the program is the Premium Assistance for Employees of Child Care Facilities. No fancy acronym, but essentially the legislature provided some funding to wrap around premiums for employees in licensed child care facilities who purchase coverage through Washington Health Plan Finder, which is the portal that the Washington Health Benefit Exchange runs. About 1 in 4 Washingtonians use our website to connect to either public coverage, Washington Apple Health coverage, or Medicaid coverage here in the state, or qualified health plan coverage, which is our marketplace coverage. So this program was designed to cover people who are just over income eligibility limits for Washington Apple Health or Medicaid, and who are under 300% of the federal poverty level. So childcare workers and professionals who are eligible for Medicaid, we facilitate them into that program. If they're over 300% of the federal poverty level, we facilitate them into qualified health plan coverage with or without federal tax credits. And then if you fall in that sweet spot between 139 and 300% of the federal poverty level, you can get a $0 premium plan for the duration of the program.
And I think one of the things that I would add that I think is unique about some of this is that this isn't really just about the owner operator or the teacher in the classroom, right? This is really looking at the individuals in that facility, whether it's a licensed family home, a center, outdoor preschool. So really just, again, looking across the variety of provider types and the variety of staff that are in those settings.
DCYF sort of starts it by contacting the child care professional and saying, this is a new service, a new program in Washington. That employee or professional is encouraged to contact Yakima Neighborhood Health Services, either through email or phone. And then Yakima, our navigators at Yakima will follow up and help them complete an online application and submit it. And to the extent that they're eligible to purchase through Health Plan Finder, they're either connected to the free and low cost care they may already be eligible for, and they don't know it. We've seen, over 1,000 people kind of newly qualify for the Washington Apple Health or Medicaid program. So just with the help of connecting them to an assister who then helps them apply for care, we've connected people to care that they were probably already eligible for, that's free. And then for the people who fit in this sort of FPL band that the state was able to fund, they make sure they get in the right plan to get them that $0 premium. And then if they're over income, they help them pick a plan that may be available to them that right now, because we have such generous federal subsidies available under the American Rescue Plan Act that passed as part of the COVID pandemic response efforts, half of our enrollees are getting plans for under $100, under $50, under $10. Our state-based marketplace has a portal. Washington Health Plan Finder is the sort of front door for all of the sort of health, multiple different available health coverage programs. So if you come to Washington Health Plan Finder, you apply for health insurance, we connect you automatically to whatever program you're eligible for. So if you're Medicaid eligible, we automatically enroll you into that program, which then gets administered by our Medicaid agency. If you're eligible for a qualified health plan, we connect you with that plan and the available federal and state assistance you may be eligible for. And then those are administered by private health carriers. So we sort of sit in a space where the good news is if you come through the front door, most people don't know which program they're eligible for. We help you fill out an application, we get you the information you need, and then we're connecting you to Medicaid or this new child care premium assistance or federal assistance that you might be eligible for. So I think I'm looking at my cheat sheet here, but there is, over 10,500 childcare professionals that work in DCYF licensed facilities are currently on Medicaid. And, there's about 1,300 of them have gotten newly covered recently, sort of since we've launched this program and sort of increased the outreach and the awareness and tried to kind of really connect the healthcare sphere and the childcare sphere together. We did a pilot program sort of in response to advocacy interest and legislator kind of preliminary interest in advance of sort of the legislative session, where we partnered with Yakima Neighborhood Health Services and just opened up their services to any interested childcare provider to give free enrollment assistance to people who work in childcare facilities and are interested in learning more about healthcare. And so that was with no dollars attached. And we saw that people were coming in. Of the 200, 300, 400 people who came through, about 70% of them were eligible for the Washington Apple Health Medicaid program. So we had a sense that there was a large percent of this population who could be eligible for free and low cost care already. And I think investing in the program and investing in the outreach and investing in kind of the partnership and the data sharing and sort of putting some structure around that relationship to kind of drive the outreach around this program did bring people who were eligible for Washington Apple Health. And then when we launched this new program, we saw, 50% of the people come in and keep going to Medicaid, and 50% came in and sort of are benefiting from this marketplace coverage.